So that's all the theory, and that's how to scan. So this is what you'll see when you scan in those 12 points. You need to be able to recognize lung sliding, A lines, B lines, and consolidation. When you put the ultrasound probe over normal lung, this is what it looks like. And this might look a bit difficult to interpret to begin with, so let's break it down. First of all, that's the probe there, right at the top. Sorry about my drawing. This is using a curvilinear probe, so that's why it looks like that. And then here are two ribs. So we scan between the ribs. We try and get a rib on either side. Ribs cast what's called a dorsal acoustic shadow, but essentially that just means that none of the ultrasound is able to go beyond the rib. And there's the lung in between the ribs. And here is all soft tissue between the probe and the lung. So the ultrasound is emitted by the ultrasound probe, and the first thing it really hits to cause a big bounce back, and so a big white line, is the pleural line. So there's a big change in acoustic impedance, and that's why that line is very bright. This pleural line, this is really important. This is the visceral parietal pleural interface. And what you want to look for is that it's moving up and down. Sometimes it's said to look a bit like crawling ants. That's called lung sliding if you can see it moving up and down. That's the first thing to look for. And if you can't see lung sliding, there's a lot of causes. If the patient holds their breath, there won't be any lung sliding. If there's a pneumothorax, there won't be any. On ICU, if the tube is down the right main bronchus, then the left lung won't be moving up and down and you won't see lung sliding. The next thing in normal lung to see is this line here, which is called an A line. A lines are horizontal lines and are a form of artifact. So the ultrasound beam is emitted by the probe, hits the pleural line and bounces back to the probe. But some of the ultrasound hits the probe and bounces off it, and then goes back and hits the pleural line and bounces back again. And then it's received by the probe. So it's like a kind of echo. Well, the ultrasound machine isn't smart enough to be able to recognize that as an artifact. So it creates that A line. If you see A lines, there is dry lung. And I'll come on to what I mean by dry lung in just a minute. So now watch the video again and locate the pleural line, the ribs, the dorsal acoustic shadow, and the A line. So normal lung is dry, it's mostly air. And in pathology, the water content of the lung increases, and you get some different artifacts. So let's just recap. There's the pleural line, that's the visceral parietal pleural interface, the edge of the lung. And there's an A line, and A lines mean dry lung. Now, as you get more lung water, you get these vertical lines, and they're called B lines. This is what you see in COVID, and they look a bit like torch lights, kind of shining out. Well, the image on the right is a bit grainy, but this lung is completely full of water. It's consolidated, and it actually starts to look like liver, so we call it hepatized lung. This is C profile, C for consolidation. So there's A lines for dry lung, B lines if there's water in the lung, and if it's completely consolidated, that's C profile. So that green line is the pleural line, and the purple lines are B lines, vertical lines, which mean increased lung water. B lines look like torch lights, and they start at the pleural line and they go all the way to the edge of the screen. If the lung water content increases even more, you stop seeing B lines and you start seeing lung that looks like liver. So this is the edge of the lung represented by the red line, and the green line represents the hemidiaphragm, below which is the liver. That's the liver in green, and there's a small pleural effusion, which I've coloured in yellow. Now have another look at the video and see if you can recognise the lung, the pleural effusion, the hemidiaphragm, and the liver. There's a transition between the lung having B lines and being fully consolidated, and this is what you see in that transition phase. This is called shred sign because you see what looks like shredded lung. This is the stage just before you get fully consolidated lung. So here's another example of hepatized lung with a small pleural effusion. We've covered lung sliding, A lines for when there's dry lung, B lines for when there's wet lung, and C profile, that's to say consolidation profile, which can either be fully hepatized lung or just before that stage, shredding. Finally, here's an appendix. Martin Duxell put this together. These are the images from a Chinese study which came out in February of the lung ultrasound changes in COVID correlated to CT. So here you can see B lines, and you can also see that the pleural line is no longer smooth. And this correlates very nicely to the CT of the same patient on the left. So remember, it's all about lung water. Initially you'll get one or two B lines, and then you'll get multiple B lines, and eventually you just get the B lines coming together. One of my colleagues says it looks like the beam from a UFO about to abduct someone, but I think we're meant to call this waterfall sign instead. Do you also see how the pleural line is no longer smooth again? So here you can see the pleural line is depressed, and again you can see B lines. This crazy paving pattern seems to be quite common in COVID. The pleural line, which is normally a bright white line, takes on a kind of speckled effect. There's a very nice letter to the editor from Poggiali et al., in which they looked at 12 patients with COVID whom they scanned, and 5 of those patients had this crazy paving pattern to the pleural line. The pleural line should normally be a bright white line, and in COVID you can get these interruptions, and what you're actually seeing there is some subpleural consolidation. So here you can see actually shredding of the lung. Here there's early shredding and a discontinuous pleural line. And finally here you can see consolidation, consolidated lung. So we've covered how ultrasound works, why it's useful for COVID, especially within the pathway we've developed at the Royal Berks. We've covered A lines, which represent dry lung, and B lines or consolidated lung, which represents abnormal wet lung. So thank you for listening.